Good day, I am for Carlo Pascal, BS and today I'll be demonstrating the tracheostomy care. For the goal, the patient exhibits a tracheostomy tube and site free from drainage, secretion, and skin irritation or break. For the equipment, check for the bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit if available, but be sure to collect supplies listed that are not available in kit, or 2 sterile 4x4 inch gauze pad and a sterile cotton tip applicators, sterile tracheostomy dressing, which is a pre-cut and sewn surgical dressing. Next is the sterile basin, a small sterile brush or pipe cleaner or disposable inner cannula, and a small brush and roll of twill tape, tracheostomy ties or tracheostomy holders, scissors, pulse oximeter, stethoscope, clean gloves, it should be 2 pairs, and mask, goggles or face shield, and hydrogen peroxide, and plain NSS or sterile water. For the implementation, bring the necessary equipment to the bedside stand or over bed table. Perform hand hygiene and put on proper protective equipment or PPE if indicated, and identify the patient. Close the curtains around the bed and close the doors in the room if possible, and determine the need for tracheostomy care and explain what you are going to do and the reason and explain what you are going to do and the reason to the patient, even if the patient does not appear to be alert. Next is to adjust the bed to a comfortable working position. It is usually below the height of the elbow of the caregiver, and lower the side rails closest to you. If the patient is conscious, place him or her in a semi-Fowler position. If patient is unconscious, place him or her in the lateral position facing you. Next is to move the overbed table close to your work areas and raise to the waistline and check waistline. Next is to check for lung sounds. Place the towel below the trachea side, covering the neck and chest of the client. Next is to put on the face shield or goggles and mask in suctioning tracheostomy if necessary. If tracheostomy has just been suctioned, remove the soiled side dressing and discard before removal of gloves used to perform suctioning. Next is preparing the basin and cleaning solutions. We mix sterile water and or plain NSS with hydrogen peroxide in one basin in a 50-50 ratio. Be sure it will be filled by half an inch. Next is to add another plain NSS in another basin that will be filled at also half an inch. Next is to perform gloving. After the gloving, now we will be cleaning the tracheostomy. Remove the oxygen source if one is present. Next is to stabilize the outer cannula and face plate of the tracheostomy with your non-dominant hand, which is my left hand. Next is to grasp the locking mechanism in the inner cannula with your dominant hand, which is my right hand, and press the tabs and release the lock. Now gently remove the inner cannula and place in the first basin with the plain NSS and the hydrogen peroxide and let it submerge there for a few minutes, and simultaneously gently slide the trachea pad dressing downward and discard. Next is to check for some exudates or drainage, skin breakdown on the skin, then clean the inner cannula of the tracheostomy tube using the prepared plain NSS and hydrogen peroxide, and use brush to remove solidified or sticky mucus. Next is to rinse off using the second basin with the plain NSS only, and discard the gloves and put on another gloves if necessary. Then dry the inner cannula using the sterile gauze pad and gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Next is to dip the cotton tip applicators or the gauze sponge in a cup of basin with sterile saline and clean stoma under the faceplate, and use each applicators or sponge only once, and moving from stoma side outwards, and pat the skin gently with a dry 4x4 gauze sponge or gauze pad, and slide commercially prepared tracheostomy dressing or a pre-folded non-cotton filled 4x4 inch dressing under the face plate. Next is to check the fit of the tracheostomy collar, and you should be able to fit one finger between the neck and the to make sure that the patient can flex his or her neck comfortably. Next is to reapply the oxygen source if necessary, or if the patient has an oxygen source in the first place. Next is to remove the gloves and assist patient to a comfortable position. Raise the bed rails and place the client in the lowest position, and remove additional PPEs if used, and we perform hand hygiene, and we do the documentation and reassess the patient's respiratory status, including the respiratory rate, effort, oxygen saturation, and the lung sounds. Good day, sir. I am Carl Pascual, a student nurse of NUST, and I'll be your student nurse for today from 8 a.m. to 12 noon. May I know your name, sir? Mr. Bugs. May I know when was your tracheostomy tube was last cleaned? Last Tuesday. Okay, sir. Okay, sir. Today I'll be performing a tracheostomy care. Will that be alright? Sir, your lungs doesn't seem to have any problem. Your oxygen saturation is also normal. we begin the assessment. Right. Okay. Next is to pour in plain NSS water on both basin. And pour in hydrogen peroxide on this other basin. And there you have it. Surface, I'm going to remove the inner tubing. Remove the wrappings. Sir, please take a deep breath. Now, sir, I'm going to remove the dressing. Okay. It seems clean and there's no any leakage. Okay. While this is looking, now it's time to clean it. And rinse it off. Next, I'm going to pat it dry. Since there are no any blockage inside and there are no secretions, I'm just going to pat it and let it dry. Next, I'll be cleaning the skin. The applicator. That's one. And again, I'm going to use another gauze pad, patted dry. Now that it's dry, I'm going to put it back on our patient. Insert. Deep breath. And I'm going to lock it. Okay. Next is cleaning the tracheotomies with the applicator. That's one. Two. Then I'm going to pat it dry. With the gauze. And now I'm going to put the gauze that we got as a dressing. Please, sir.